Hi, I'm Dr. Jim Carlson from the Riverside Animal Clinic, and we're doing custom holistic testing analysis for case number 01766, 7-year-old Border Collie. Had a history of hind paw hair loss and redness, and the main deficiencies right now are a weak small intestine, weak stomach, and stressed circulation. Rest were balanced and green. And so how does this all work? Well, if we look at circulation in comparison to the stomach and small intestinal tract, circulation affects how well the GI tract receives blood flow. And so if the GI tract doesn't receive 100% blood flow, it can restrict digestion. And that can lead to issues with the enteric nervous system, 80% of the immune system, so we can see inflammation, and certainly interrupt digestive function. And a Border Collie having a herding nature, often between anxiety from the enteric nervous system and impaired circulation, can have an effect on the small intestine, as demonstrated by the SI. Small intestine supports the stomach, which supports the lung. Lung is its connection to the skin, which is an outer lung, needs to breathe, and the pores of the skin are really important for normal skin health and skin function. And then certainly we saw it affect the paws. So that's the pathway. And in order to restore that, we start up here with the small intestinal tract. And so what I'm recommending that we do is we use Drain Par for 3 months at 2 drops a day to balance these 3 points. Retest in 3 months, see how well these have rebalanced. The second thing is use Stomach Happy to help with the intestinal tract. And certainly with any herding dog, having exercise. And herding dogs like to do things that are related to herding. So even going to a farm where the Border Collie can get out and learn some herding skills sometimes can help with anxiety as well. And that can have a positive effect on the paws and reduce skin inflammation and redness and hair loss. Thanks so much.
I just have one question.
Okay.
So when you're talking about this, it's sort of a little bit of a foreign language to people who don't do this every day, even to me. So can you explain the traditional Chinese medicine way of thinking here?
Yes, if we add a couple more, we add liver and kidney. This is called the Shen cycle. And so small intestine supports stomach, supports lung, supports kidney, supports liver. Certainly the co-cycle is that they cross each other to control. And if we look at support function, when we're going around in a circle here supporting each other, if one is not supporting each other or one is overriding the other, then we can see imbalance. And that imbalance can be expressed as a genetic expression in the way of inflammation or any type of other expression that the normal patient does.
And that's how Chinese medicine works.
That's how Chinese medicine
and
works.
The pattern, it's a pattern.
Right. The
Correct.
pattern versus a diagnosis. In Chinese medicine, it's strictly a pattern versus a diagnosis of atopic dermatitis. This would be considered a heat pattern in the stomach.
Okay.